Imagine waking up every single morning feeling like you have already run a marathon in your sleep. Your eyelids feel heavy, your legs are lead, your brain is wrapped in fog, and no amount of coffee or rest seems to bring back that bright, energetic version of yourself you used to know. You glance in the mirror and notice your skin looks strangely pale, almost ghostly. Your nails chip and split no matter how much moisturizer you use. Strands of hair collect in the shower, drain faster than ever before. Tiny, painful cracks appear at the corners of your mouth, refusing to heal. And those dark circles under your eyes? They make you look permanently exhausted even after a full night's sleep. You tell yourself it is just stress, poor sleep, or maybe the changing seasons. But deep down, a quiet worry grows. What if something is actually wrong inside me? What if my body is screaming for help in the only way it knows how? Very often, that hidden cry is coming from one of the most common yet most overlooked nutritional deficiencies in the world: iron deficiency. Iron is not some obscure mineral you only hear about in biology class. It is the essential building block your body uses to make hemoglobin, the oxygen-carrying protein inside every red blood cell. Without enough iron, your blood cannot deliver adequate oxygen to your muscles, brain, heart, skin, hair follicles, and every other tissue that keeps you feeling alive and vibrant. When iron stores run low and eventually deplete, the condition progresses to iron deficiency anemia, the single most widespread nutritional disorder globally, affecting billions of people, especially women, children, pregnant individuals, vegetarians and vegans, and anyone with heavy menstrual bleeding, digestive problems, or frequent blood donation. The beautiful truth is that iron deficiency is usually very treatable. Once identified through simple blood tests, most people feel dramatically better within weeks to months after correcting the deficiency with the right foods, improved absorption habits, and, if needed, doctor-guided supplements. In this ultra-detailed, doctor-explained guide, we are going to cover everything you need to know about iron deficiency and iron deficiency anemia. We will start with a clear explanation of what iron does in the body, why deficiency develops so easily, and how it progresses from mild depletion to full-blown anemia. Then we will dive deeply into the 5 most visible, telltale signs that doctors and patients notice first, explaining exactly what each looks like, why it happens physiologically, how long it typically takes to appear, what makes it more obvious in certain people, and real-world clues that separate normal variation from this needs attention now. After the visible signs, we will explore the invisible but equally important symptoms you feel inside, the most accurate ways doctors diagnose the problem, practical and delicious ways to boost iron intake through food, smart strategies to maximize absorption, when and how supplements should be used safely, potential complications if left untreated, special considerations for different life stages and diets, and clear guidance on when to see a doctor urgently versus scheduling a routine checkup. By the end, you will have a complete roadmap, empowering you to listen to your body, spot early clues, and take confident action toward feeling strong, clear-headed, and full of natural energy again. Let us begin with the fundamentals, so every symptom makes perfect sense. What iron actually does inside your body, and why running low is so devastating. Iron is a trace mineral, but it plays an outsized role. The majority of the iron in your body is found in hemoglobin, the protein inside red blood cells that binds oxygen in your lungs and releases it to every tissue that needs it. A smaller but critical portion is stored in myoglobin, which supplies oxygen to muscles during activity, and in enzymes that power energy production inside cells. Yet another portion is bound to transport proteins, transferrin, and held in storage depots, ferritin and hemosiderin, in the liver, spleen, and bone marrow, ready to be mobilized when needed. Your body is remarkably efficient with iron. It recycles almost all of it from old red blood cells that die after about 120 days. Healthy adults lose only about 1 to 2 milligrams per day through skin shedding, urine, sweat, and minor gastrointestinal bleeding. Women of childbearing age lose additional iron during menstruation, and everyone loses a tiny amount through normal digestive tract turnover. Daily needs are therefore modest but non-negotiable. Adult men and postmenopausal women, approximately 8 milligrams per day. Premenopausal women, approximately 18 milligrams per day. Pregnant women, up to 27 milligrams per day. When intake, absorption, or recycling cannot keep up with losses, iron stores, measured by ferritin, drop first. When stores are exhausted, hemoglobin production slows. Red blood cells become smaller and paler, microcytic hypochromic anemia, and oxygen delivery to tissues declines. Every cell, organ, and system begins to feel the shortage. Common reasons iron deficiency develops include inadequate dietary intake, especially in plant-based diets where non-heme iron is less absorbable. Increased losses, heavy or prolonged menstrual bleeding, frequent blood donation, gastrointestinal bleeding from ulcers, hemorrhoids, inflammatory bowel disease, or colon polyps/cancer. Poor absorption, celiac disease, atrophic gastritis, Helicobacter pylori infection, use of antacids or proton pump inhibitors long-term, gastric bypass surgery. Increased demand, pregnancy, rapid growth in children and adolescents, intense endurance exercise. Now let us move to the 5 most visible signs doctors and patients notice first, often long before severe anemia sets in. Visible sign 1. Pale skin and especially pale inner eyelids, conjunctival pallor. One of the earliest and most reliable visual clues is a noticeable loss of healthy color in the skin and mucous membranes. Your complexion may look washed out, dull, or almost grayish. Friends or family might comment that you look tired or sickly, even when you feel you are sleeping enough. The single most specific place to check is the inner surface of the lower eyelid. Gently pull your lower lid down and look in a mirror. In a person with healthy iron levels, the inner conjunctiva appears bright pink to red, richly supplied with small blood vessels carrying oxygenated hemoglobin. In iron deficiency, it looks pale pink, whitish, or nearly the same color as the surrounding skin. Why it happens? Hemoglobin gives blood its characteristic red color. When hemoglobin levels fall, less red pigment is visible through translucent tissues like skin and mucous membranes. The conjunctiva is especially revealing because it is thin, well vascularized, and not influenced by skin pigmentation as much as facial skin. Red flags, pallor that develops gradually and persists, especially when combined with fatigue. Very dark skin tones may show pallor most clearly in the conjunctiva, palms, nail beds, or inner lips. Visible sign 2. Brittle, thin, or spoon-shaped nails, koilonychia. Your fingernails, and sometimes toenails, become fragile and break or chip easily no matter how carefully you care for them. They may grow more slowly, develop ridges, or, most characteristically, flatten and then curve upward at the edges so the nail looks like a spoon, koilonychia. You can often hold water in the concave bowl of the nail. Why it happens? Iron is essential for normal cell division and keratin production in the nail matrix. Chronic deficiency disrupts nail plate formation, leading to structural weakness and abnormal shape. Koilonychia is considered a classic, though later stage, sign of long-standing iron deficiency. Red flags, spooning that affects multiple nails, especially the index, middle, or ring fingers. It usually reverses slowly once iron stores are replenished. Visible sign 3. Excessive hair thinning or diffuse hair loss. You notice far more hair than usual on your pillow, in the shower drain, or on your brush. Your ponytail feels thinner, your part looks wider, and overall volume decreases noticeably. Hair may grow more slowly and feel finer or drier. Why it happens? Hair follicles are among the fastest growing tissues in the body and are highly sensitive to oxygen delivery. When iron is low, follicles receive less oxygen and shift prematurely from the growth phase, anagen, to the resting and shedding phase, telogen. This leads to telogen effluvium, diffuse, non-scarring hair loss that typically becomes obvious 2 to 3 months after iron stores drop significantly. Red flags, sudden increase in shedding, more than 100 to 150 hairs per day, thinning that is evenly distributed rather than patchy, and loss accompanied by fatigue or pallor. Visible sign 4. Painful cracks at the corners of the mouth, angular cheilitis. Red, sore, cracked, or fissured skin appears at one or both corners of your mouth. The cracks may bleed, crust over, or become infected with yeast or bacteria, making them painful when you smile, eat, or speak. Why it happens? Iron deficiency impairs skin repair, reduces immune function in mucosal tissues, and often coexist with deficiencies in other nutrients, riboflavin, vitamin B6, zinc, that also contribute to angular cheilitis. Chronic saliva leakage into the cracks worsens irritation. Associated signs: smooth, red, swollen tongue, atrophic glossitis, burning mouth sensation, or altered taste. Visible sign 5. Prominent dark circles, puffy or tired-looking eyes, and sunken under-eye area. The skin under your eyes appears darker, almost bruised, even after plenty of sleep. The under-eye area may look puffy or hollow, giving a chronically fatigued or older appearance. Why it happens? Reduced oxygen-carrying capacity makes small blood vessels under the thin skin more visible, creating a bluish or purplish tint. Chronic fatigue and poor tissue oxygenation contribute to fluid shifts and a tired facial expression. Red flags: dark circles that worsen with fatigue and improve noticeably once iron levels are corrected. Invisible but equally important signs you feel inside: extreme, unrelenting fatigue and weakness, often the earliest and most debilitating symptom. Shortness of breath during normal activities. Cold hands and feet, poor circulation and oxygen delivery. Rapid or pounding heartbeat. Heart compensates for low oxygen. Dizziness, lightheadedness, or fainting when standing up. Frequent headaches or difficulty concentrating, brain fog. Pica. Unusual cravings for non-food items like ice, clay, dirt, or starch, a classic clue. When and how to get tested accurately. Do not wait until symptoms are severe. Ask your doctor for testing if you have 2 or more of the visible signs plus fatigue, or if you belong to a high-risk group. Heavy or prolonged menstrual bleeding. Pregnancy or recent childbirth. Strict vegetarian or vegan diet. History of gastrointestinal issues, celiac disease, inflammatory bowel disease, gastric bypass. Frequent blood donation. Chronic fatigue with no clear cause. Key blood tests include: complete blood count, checks hemoglobin, hematocrit, red blood cell indices. Mean corpuscular volume is usually low in iron deficiency. Serum ferritin, best single indicator of iron stores. Levels below 30 nanograms per milliliter suggest deficiency, below 15 indicate depleted stores. Serum iron, total iron binding capacity, and transferrin saturation help differentiate iron deficiency from other anemias. Respiratory count and peripheral blood smear may show microcytic, hypochromic cells. How to raise iron levels safely and effectively. Prioritize iron-rich foods. Heme iron, from animal sources, absorb 2 to 3 times better. Red meat, beef, lamb. Poultry, especially dark meat. Fish and shellfish. Liver and organ meats, in moderation. Non-heme iron, from plants. Absorption improved by pairing with vitamin C. Lentils, chickpeas, beans. Spinach, kale, Swiss chard. Tofu, tempeh. Pumpkin seeds, sesame seeds. Quinoa, fortified cereals. Dried apricots, raisins. Maximize absorption. Pair iron-rich foods with vitamin C sources, citrus fruits, strawberries, bell peppers, tomatoes, broccoli. Avoid drinking tea, coffee, or calcium-rich foods/drinks with iron-containing meals. Tannins and calcium inhibit absorption. Cook in cast iron pans. Add small amounts of absorbable iron. Supplements, only under medical guidance. Common forms: ferrous sulfate, ferrous gluconate, ferrous fumarate. Take on an empty stomach if tolerated, with vitamin C to boost absorption. Side effects can include constipation, dark stools, nausea. Slow release or lower dose forms help some people. Never self-medicate long-term without testing. Excess iron can be harmful. Serious complications if left untreated. Severe anemia leading to heart strain, high-output heart failure. Impaired immune function and increased infection risk. Developmental delays in children. Poor pregnancy outcomes, preterm birth, low birth weight. Restless leg syndrome. Cognitive and mood problems. When to seek urgent medical care. Go to emergency care or your doctor immediately if you experience chest pain or severe shortness of breath, fainting or near fainting episodes, very rapid heartbeat with dizziness, black or tarry stools, possible gastrointestinal bleeding, extreme weakness or confusion. Iron deficiency is incredibly common, but it is not normal, and it is not something you have to live with forever. Your body is giving you visible clues for a reason. Listen to them. A simple blood test can confirm what is happening and the right steps, starting with food, absorption habits, and medical guidance, can bring back your energy, strength, glow, and joy. You deserve to feel vibrant every day. Take that first step, schedule the test, add one iron-rich food to your plate today, and watch how quickly things can change. You have got this, one breath, one bite, one stronger day at a time.